Okay, good morning. First of all, I would like to welcome honorable ministers. We had a very productive discussion, and this is actually the first visit after the lockdown. As you know, the situation in Western Europe is improving. Of course, in the rest of the world, the pandemic is on the increase. And we discussed about the situation of the pandemic globally and on issues of what should be done. But I would be happy to give, and both Germany and France came to show their support. And I would first give the floor to His Excellency, and then we will proceed. Please.
I'm going to talk in French. Sorry for that. Dear Dr Tedros, dear Jens Spahn, je suis venu ici pour représenter la France à Genève, au siège de l'Organisation mondiale de la santé, en présence de mon homologue allemand Jens Spahn et en présence du Dr Tedros, pour réaffirmer le soutien de la France et du couple franco-allemand au fonctionnement de l'Organisation mondiale de la santé, dans ce qu'elle représente de structures multilatérales, mondiales, globales, un outil indispensable dans la lutte contre l'évolution des maladies, et notamment, nous le voyons dans la période, contre les maladies infectieuses. Le rôle majeur de l'OMS induit aussi un travail que les États conduisent de leur côté, d'évaluation du mode de fonctionnement de la structure, avec un gros travail sur la transparence dans l'accès aux données, au fonctionnement général. Et je suis venu redire la confiance de la France dans la capacité de l'Organisation mondiale de la santé à faire face à ces risques sanitaires émergents et à conduire ce travail d'évaluation pour aller vers le mieux. Je suis venu également annoncer un renforcement de la contribution française au fonctionnement de l'OMS, avec d'abord 90 millions d'euros qui seront utilisés dans le cadre de la construction de cette magnifique académie OMS à Lyon, pas très loin de Genève, et qui porte en elle ce beau projet de la coopération internationale en matière de recherche appliquée, recherche fondamentale, et qui sera amené à former de très nombreux scientifiques, aujourd'hui et demain, pour renforcer la coopération internationale. Et nous le voyons avec la crise du Covid-19, cette coopération est plus indispensable que jamais. Par ailleurs, 100 millions de masques seront donnés par la France à l'OMS pour protéger les populations les plus fragiles. Et enfin, la France renforce sa contribution financière. Le président de la République, Emmanuel Macron, l'annonce à hauteur de 50 millions d'euros, en plus des crédits de fonctionnement auxquels la France contribue habituellement. L'autre message que je suis venu porter, c'est un message pour lequel le président de la République française insiste beaucoup, c'est dans le cadre de la démarche qu'on appelle ACTA, la démarche d'accélération, et notamment cet enjeu du bien public mondial. À l'heure où de nombreux laboratoires dans le monde sont en train de développer de la recherche et où les premiers vaccins arriveront, nous l'espérons, dans les prochains mois, la France insiste beaucoup pour que ce vaccin soit accessible à tous, à ceux qui peuvent payer et à ceux qui ne le peuvent pas. Cette démarche de coopération internationale doit être renforcée par l'intervention de l'Organisation mondiale de la santé. Ce sont les principaux messages que je suis venu porter au cours des échanges que nous avons eus avec le Dr Tedros, que je remercie pour son accueil. C'était mon premier déplacement ici à l'OMS et je crois que le symbole du déplacement du couple franco-allemand est un symbole important dans la période.
Merci beaucoup. I think I will need translation. And now, Minister Spahn.
Dear Director-General Tedros, dear colleague Veran, ladies and gentlemen, it is a great pleasure for me to speak during the WHO Member States Information Session today. Thank you again, Director General, for the invitation. Germany has the honor to host the EU Council presidency for the next half a year. global health and the support of the WHO is a key theme during the current pandemic. This is why I have come to Geneva in order to discuss our EU presidency plans and ways to further support WHO at this critical moment in time. Together with my colleague and friend, the French Health Minister Olivier Veran, I had very promising discussions with Director General Tedros. Germany remains a strong supporter and a friend, sometimes a critical friend, but a strong friend of the WHO. The still ongoing pandemic shows that an interconnected world needs global-level crisis management. We need a strong, efficient, transparent, and accountable WHO today more than ever. A WHO that is able to lead and coordinate the response of global health crisis. Germany will do its part to give the WHO the political, financial, and technical backing that is needed. This comes with the clear expectation that remaining challenges are adequately addressed and needed reforms are pushed forward in order to strengthen the emergency program as well as WHO's work under the International Health Regulation. Germany is a strong partner and supporter of this responsive WHO, and we very much appreciate the steps Director General Tedros already has taken and the initiatives that are planned. Therefore, it is a pleasure for me to announce that we, as the Federal Republic of Germany, are supporting WHO with additional 41 million euros for its core mandate until 2023. Additional to this, we are providing additional 25 million euros for the implementation of the Strategic Preparedness Response Plan. And due to the still remaining major funding gap to implement the Strategic Preparedness Response Plan, until the end of this year, the German government has decided to provide additional 200 million euros to WHO on top of the 110 million euros for the WHO, which we have already pledged during the vaccination summit in Brussels in May. This funding still needs approval by Parliament, but we are very confident that Parliament will release this start of July. And we understand that besides money, also medical equipment is needed in many parts of the world. Therefore, we want to offer WHO medical masks and medical equipment, including ventilators, for distribution to countries in need. Including this medical equipment, the German Ministry of Health will be providing more than 500 million, more than €500 million to WHO this year. This is the highest amount ever that we have contributed to the WHO in 1 year. This is a clear sign for our dedication to the work of WHO. Our common message should be today: we are standing together, fighting global health problems. We are convinced in a pandemic you have to react on national level, but you have to coordinate the reaction internationally and with all partners around you and on the world. Isolated national answers to international problems are doomed to fail.
Thank you. Thank you so much, Minister Spahn. Thank you, Minister Veran. WHO is really honored to welcome you both here today, and we offer our sincere thanks for your expression of solidarity and support. We're getting today all the support we need, political and financial, as has been said, and I would like to express my gratitude. And thank you so much for all that support. Both Germany and France are long-standing friends of WHO and global health, both individually and as members of the European Union. For more than 50 years, France has hosted the International Agency of Research on Cancer in Lyon. And last year, I was honored to sign an agreement with President Emmanuel Macron to establish the new WHO Academy in the same city. Likewise, Chancellor Angela Merkel has been a champion of global health, becoming the first world leader to address the World Health Assembly in 2015. But not only that, the first leader also to invite WHO in 2017 when Germany was hosting the G20, understanding the importance of health and the centrality of health. Germany was also instrumental in the development of the Global Action Plan for Healthy Lives and Well-being for All, bringing the global health community together to drive progress towards the Sustainable Development Goals. Today, we're deepening that friendship. WHO is a member state organization, a family of nations. WHO is what its member states decide it should be, and works with the resources its member states decide it should have. Since I took office 3 years ago, WHO has embarked on the most significant transformation in its history. Our aim has been to transform WHO into the organization the world needs, an organization that delivers results for the people we serve. Every day, WHO works all around the world to promote health, keep the world safe, and serve the vulnerable. Every month, we detect and respond to more than 7,000 public health events and potential emergencies all over the world. The COVID-19 pandemic is a once-in-a-century event that has shown the world was not as prepared as it should have been. We must all learn the lessons it's teaching us, that we are one humanity and none of us are safe until all of us are safe. And next week, Germany will assume the presidency of the Council of the European Union. This is a critical period for Europe, for the world, and for WHO. Now more than ever, the world needs leadership. Now more than ever, the world needs international cooperation. Once again, I offer my profound thanks to France and Germany for your leadership and support. Vielen Dank, merci beaucoup, and thank you. Thank you very much.
Very much, Honorable Ministers and Director General. We'll have now time for 2 questions as announced. We'll take Agence France Presse first, please. I'll hold it.
Okay, sorry. Thank you. Nina Larson from AFP. So I just wanted to say to both ministers, you've announced a lot of support and funding to WHO today. I'm wondering how far this goes to actually filling the hole left by the U.S. withdrawal, if you could answer that, and if you also have some comment on whether the EU is planning on blocking travel from the U.S. and Brazil, perhaps. Thank you.
Can I ask Minister Veran, perhaps, first?
Sorry? Shall I?
Minister Spahn?
Shall I take this one? So first of all, the biggest amount of the funding I just announced goes to the Strategic Preparedness Response Plans, so actually addressing COVID-19 and to help especially countries highly affected right now and that need support, perhaps even more support than we would have needed here in Europe regarding the health system and the possibility to answer to this crisis. So that is, first of all, where we want to do more and where we want to increase our funding. But of course, we have to discuss within WHO and with the other member states and with the US how we actually will work and deal with possible changes. So far, it's not sure what's about to happen to the funding there. The US have always been a very big and very much appreciated contributor to the WHO. They have shaped many of the programs, by the way, many programs in Europe too, and in the Euro region of WHO. And so actually we still want to be in touch with them and discussing with them how we can go on together within the WHO. Regarding traveling to Europe and the European Union, that is an ongoing process of negotiating and consultation within the European Union and of member states. And since it is ongoing, I can't tell you the result yet.
You quickly to repeat the question in short words for the Minister Veran.
En français? OK. Je suis anglophone, mais bon, voilà. Attendez, excusez-moi. Alors, je voulais savoir les contributions que vous avez annoncées ici aujourd'hui. Ils vont aller jusqu'où pour remplir le trou qui est laissé par la sortie des États-Unis pour l'OMS. Et aussi, j'ai posé la question sur les discussions à l'UE, à l'intérieur de l'UE, sur un éventuellement blocage des voyageurs des États-Unis et du Brésil, et si ça serait justifié. Merci.
Et c'était Nina Larson, Agence France Presse.
Sorry for the confusion. I hope I will do the same answer than Jens. It would be better. I will do it in French. La contribution française n'a pas pour objet de remplacer la contribution américaine. La contribution française, elle est là pour rappeler à l'Organisation mondiale de la santé qu'elle peut compter sur l'amitié de l'Union européenne et du couple franco-allemand. Une amitié qui est exigeante, puisque nous demandons et nous participons avec l'Organisation mondiale de la santé à la démarche d'évaluation que l'OMS a initiée, de manière à apporter toutes les réponses en transparence à la population mondiale sur le fonctionnement de l'organisation, sur les partenariats, sur le partage de données, sur comment est-ce qu'on peut faire évoluer la structure face aux risques émergents, et notamment face aux épidémies. Nous l'avons vu avec cette crise de la Covid-19. Donc, transparence, soutien, amitié. Moi, je crois profondément que le monde a besoin plus que jamais d'une organisation mondiale, globale, multilatérale. Je crois que nous ne pouvons pas nous payer le luxe de nous séparer de partenaires. Fut-il en ce moment interrogateur sur le fonctionnement de la structure. Je crois profondément, encore une fois, que nous avons besoin d'une réponse mondiale et que seule l'OMS est capable de l'apporter. Sur la deuxième question que vous posiez, nous protégeons la santé des habitants en France, dans l'Union européenne, en Allemagne, et nous faisons en sorte que les règles que nous pouvons imposer à nos propres populations soient cohérentes avec les règles que nous imposons à celles et ceux qui viennent de pays dans lesquels le virus circule peut-être de façon plus importante que chez nous. Il n'y a pas de volonté d'ostraciser ou d'empêcher quiconque de venir en France. La France est une terre d'accueil, l'Europe est une terre d'accueil. Par contre, il y a des mesures de précaution qui sont importantes. Nous avons rouvert les frontières européennes, et c'est tant mieux. Bientôt, il y aura une réouverture de frontières hors de l'espace Schengen, mais nous avons à cœur de protéger la sécurité et la santé des Européens et des Français. C'est pourquoi nous regarderons situation par situation, en fonction de l'évolution de la circulation du virus, des mesures qui sont mises en place par les pays pour freiner la diffusion du virus, en cohérence, encore une fois, avec nous-mêmes et les demandes que nous avons en direction de nos propres populations.
Thank you very much. And we have a second question now from German television, ARD. Wolfgang Warner.
Question concerning the vaccine. France, Germany is investing a lot in a possible vaccine. And how will you ensure that really everyone on this planet will benefit of this vaccine, or it's just for your own purpose or purpose of the European Union, for example?
Well, that's obviously there's very much hope related to this research for vaccines, and we have several promising candidates of different research groups or companies. And what we want to make sure from the beginning is that there is access to vaccination for the whole world, for all people on the world, and that is why we are very much committed as Germany, together with France, as a European Union, to support financially and technically all the international initiatives like Gavi, CEPI, the ACT of the WHO, actually in developing such vaccines and in supporting all those who are doing research. And that is a strong commitment, a commitment that is underlined with actually many, many millions of euros, and that actually shows that it is not just saying that we want to make it happen from the very beginning of the founding or finding of a new vaccine, but we want really it to happen that there is equitable access from the beginning for the whole world. And this might be, for the first time, the case. And it might be, from today's point of view, with what we see, one of the shortest development times for a vaccine in history. But at the same time, you have to say that developing a vaccine always can still fail. So we really do see promising candidates. We are supporting it. We are supporting equitable access from the beginning, and it would be a big relief for all of us and the whole world if there was a vaccine. And so by all this, you can see we are very much committed, and of course committed to make sure that we have vaccines for the whole world, which means Europe, but the rest of the world too.
Further comments? I'm being told.
Just 3 words to answer to this question. Global public good. Global public good. Very important for the President Macron too, who promotes this concept, which has to become a fact, and we have to work hard with pharmaceutical companies to reach this point, this objective. Global public good.
Thank you very much, Honourable Ministers, Director General. This concludes our briefing. Thank you all for attending, and I thank you all, and good luck at the mission briefing now. Thank you.